Youth mental health. Young people struggling with depression, low self-esteem.
I feel like it's so common that, people feel like, oh, maybe I just, this is normal, so they don't feel comfortable reaching out.
A lot of people have been able or learning to mask it.
The suicide crisis in our community.
Suicide has become one of the leading causes of death among youth.
What's causing the crisis?
I think as a parent, it's really helpful to listen, to reflect on what the child is saying, and be able to show up for them in the way that the child needs.
Tonight, we highlight resources and solutions for struggling families. This is an ABC 11 Eyewitness News special conversation, The Silent Struggle.
Hi everyone, thanks very much for joining us for this ABC 11 conversation about youth mental health. I'm Steve Daniels, your host for the evening. We'd like to thank UnitedHealthcare for sponsoring tonight's discussion, and we all know it is a much needed and very important conversation. The latest report for the Centers for Disease Control and Prevention shows emergency department visits are still up from 2019, the year before the pandemic. More than 4,000 visits across the country for mental health conditions in 2022 among teen girls and 2,400 for teen boys. Last year, suspected suicide attempts were nearly 4 times higher among teen girls than teen boys. And opioid overdoses increased by 27% between 2021 and 2022, with bigger increases among teen boys. Tonight, we want to get to the bottom of what's causing the issues and talk about resources and solutions for families. Joining us tonight, Chad Stage. He's the Associate Director for Behavioral Health for UnitedHealthcare Community Plan of North Carolina. Terry Putnam is the co-director of NC Project Aware Activate. It's a collaboration between the State Department of Public Instruction and the State Department of Health, focused on getting mental health resources to young people. And Ann Senna is a technology professional here in Raleigh. I'd like to begin by getting all of your thoughts in about 30 seconds about your biggest concerns about teen mental health and specific societal factors contributing to your concerns. And I know you have 2 teen boys in your house. Tell us what you're hearing from them and your biggest concerns.
Well, I think the challenge and the opportunity is that I want my 2 boys to live in the real world as well as live in the digital world. And I think that there's a balance that as a parent I need to strike, giving them the freedom to connect with their friends online, to explore online, but also to give them the support and connection that they need, I think, as they're living with me and my husband Bill, to know that if they see something, because the question to me is not if they will, it's when they're going to see something online that causes them concern or they have questions about or upsets them. And so I want them to know that they can always come to me, and they do come to me to talk to me about things that might be happening online, and also things bleed over from online into schools. Mm-hmm. So texting and conversations on social media. I find that it's often easier to say something digitally to someone than in person. You don't see the look of hurt or reaction, and I think that sometimes gives that facade of no impact or lesser impact, and it's very, very significant and real for teenagers.
We'll talk more about social media. We'll dive deeply into that, and you have some great tips about how you talk to your teen boys, so I can't wait to share that with everyone coming up. Chad, you have 2 teen girls in your house. Tell us about your biggest concerns that you see through the eyes of your girls.
Yeah, so to piggyback on what Ann said, I think that the fact that our society has become so attached and fixated on technology and our phones in our hand and what we do online, that I think online bullying is a real problem. There are so many sort of baked in stressors to be a teenager, whether it's the biological or hormonal changes that are occurring, but the need to fit in socially is such an important thing in your teenage years, and bullying has evolved. It's not the schoolyard bully that we knew growing up. It's the bully that's getting you when you go online. It's someone who's connecting with you on social media. So it's really important for parents to try to stay on top of what is happening on your children's phone, what kind of apps are they using. But that can be very hard because it's an ever-changing and ever-trending landscape.
Mm-hmm. Terry, you're really on the front lines of this, working statewide on these kinds of concerns. What are your biggest issues that you see right now?
Well, I definitely agree with social media, and they did a great job of clarifying the issues and strategies. But for me, especially as a licensed clinical mental health counselor, the thing that is most alarming is the suicide rate. The North Carolina just came out with a mental health report card, and 1 in 5, you had the stats up earlier, North Carolina high school students had thought about or actually attempted suicide. And that's very alarming to me. So we know social media plays a part of that. Project Aware Activate that I'm involved in, it targets rural counties. We have 6 counties in North Carolina that have this grant. And so what we want to do is look at how can we address mental health issues in a rural county that doesn't have as many resources. So that's my other big concern, is that I think that COVID has forced us to become more aware. People are actually, we have a higher incidence of mental health struggles, but we also became aware that, oh my gosh, we need resources. We really need resources. So especially our rural counties, that is a big concern for me. So suicide rate and the lack of mental health resources, especially in rural counties.
Yeah, that's such a challenge. You mentioned suicide, Terry. While we're on that subject, we've obviously seen the tragedy unfolding at NC State this year, college-age young people. What do we need to be most aware of when it comes to suicide prevention and potential warning signs?
Yeah, such an important question. I think that we know 1 in 5, so it's not somebody else. We probably know somebody. You have a college student, they probably know someone who's struggling with mental health issues. So I think anything we can do to help remove the stigma of talking about depression, anxiety, or any other mental pressures of being in school, that definitely helps. There is a 988 national crisis line that North Carolina is a part of. So it is a suicide line that students or anyone can text or call for emotional support. It's 24 hours a day and it's confidential. So that is 988. That's big. Telehealth is huge, because if you're a college student and maybe you don't want your friends or anyone to know that you are getting counseling, most of our universities have school counseling centers, but if you do not want others to know, you can link with a mental health professional through telehealth. So that's big. You talked about signs and symptoms. So what we know is if your friend or actually your child has an appetite change, they aren't eating, or they're eating too much. If they normally are social but they're isolated, not wanting to be with their friends. If their grades are dropping, anything significant, if they've had a breakup in a relationship, graduating, all of the different pressures. So really we're looking at a difference in their behavior from their normal. And there's actually a program called Mental Health First Aid. I'm sure Pro Chad's aware of it. And they actually say in that program to go ahead and ask the question, are you thinking of harming yourself? We usually want to tiptoe around it, but in today's world, we just need to go ahead and ask that. And then we can reach out and get the support students need.
Chad, you have some tips you wanted to share with people as well in terms of warning signs. What are those to build on what Terry was sharing with us, the things that we as parents and friends should be looking out for?
Yeah, no, I think Terry described a lot of them. So change in appetite, sleeping disturbances, withdrawing from activities that they might have otherwise, enjoyed in the past. And then that low energy and the eating changes they're all things that you need to be aware of.
I want to dive into social media because it is so predominant in our lives. A lot of you talked about that here just a moment ago, and I think it's important to share with everyone that less than a month ago, the U.S. Surgeon General, Vivek Murthy, really called out social media as a driving force behind the surge in children's mental health challenges. And he actually encouraged members of Congress to regulate how social media platforms are marketed to and used by kids. And let's begin with you. What are the options for keeping an eye on social media, and also walk us through some of the differences between Apple and Android products when it comes to keeping an eye on your child's activity.
The first thing I'll say is that as a parent, it is daunting and probably a bit scary to think about facing how do you monitor your children online. It's complicated. I'm a technology professional, so my background has lended myself to a place where I have the patience and the wherewithal, the trial and error. But ultimately, I use the Bark app. It's a two-phased. I have a device on our home network that actually filters certain websites where my sons can't even access it, or any guest in our home. But then they also have the Bark application on their laptops and their phones. And what it does is it essentially, I provide their username and passwords for all their social media accounts, their email accounts, and also I install it on their browser. And so basically Bark monitors what they're searching, what the conversations that they're having or what they're a part of through text messages or online, and then it flags them for me to take a look, whether it's self-harm or depression or medical concerns or bullying. So it's a way for me to know as a parent, hey, I need to go talk with one of my two sons or both of them about something that has been flagged. Sometimes it's innocuous and it's not a big deal. Other times it allows a conversation that I can have. But what I would say is oftentimes parents come to me and say, it is so confusing and so hard. And all I would say is really reach out to the resources that are available through the different platforms. Bark has a great support service, and talk to other parents too, because it is possible to have those controls in place. And again, nothing takes the place of having a great conversation and a great relationship with your children. And I will say that not every child has that. And so that's why I really do feel like it's so important that, in my hope and prayer for every child in our community and nationwide, is that they have at least one adult that they can trust. That might not be their parents, but if something happens that's upsetting them and they are feeling isolated and alone, that they can go to a coach, or they can go to a teacher or a Boy Scout leader or whatever it may be. That's my prayer, because really it's the human connection in this world of in-person and digital. It's the human connection that's going to help people when they're having the hardest struggles in their lives. And your teenage years are really, really tough.
And we really need to encourage young people to reach out and find that person in their life, right? Whether it's their parent or a coach or a teacher, yes, and really encourage them to lean on that person and develop a relationship with that person. And so let's just dive into this so everyone understands what we're talking about. It's called Bark, B-A-R-K.
Yes.
That's the software you're talking about. And
yes,
it sounds like there's an app you download. Is there
yes,
some hardware you buy?
yes,
Is there something you buy as well?
For your house, there's a hardware unit as well that you can install as well. So there's two different things. And really the application allows me to also make sure that my controls exist if my sons are at someone else's network at school or at home or out at the mall or whatever it may be. So it also provides that too.
So it flags text messaging, things that they're seeing on social media. Does it also track their online activity, what they're accessing online?
Yes, absolutely.
Mm-hmm. And to parents who might be concerned that they want to give their teen some latitude, some space.
Yes.
What do you tell them about that? This kind of big brother looking in on what they're doing.
Well, I would say that I've had intentional conversation with my 15-year-old. I know that he's going to be going to college in 3 years. Mm-hmm. So I'm going to start stepping it back over time as I feel like he can handle it. So there is levels of control that you can have, or visibility you can have, and you can certainly step that back as well.
And how do your boys, how have they taken this Bark app that you have?
It's a non-negotiable, they know, but they also say, oh, this app is draining the battery on my phone or whatever it may be. But
Mom, I gotta get this app off of here. It's draining the battery.
They know it's a non-negotiable.
Yeah.
And I think they just accept it because they know that I'm trying to help protect them and help them support them.
And it sounds like what goes with that, the hardware and software from Bark, is also the conversation you're having with them.
Yes, absolutely. Mm-hmm. And we call it car talk because I take them to school and pick them up. You know, I have very intentional conversations about all sorts of things: alcohol, drugs. Also, someone else on this conversation was mentioning around children, adolescents, and young adults withdrawing. I asked my sons to pay attention to their classmates that all of a sudden might be withdrawn or really acting out and angry, because they know and I want them to have their feelers out, that they can sense that there might be something wrong, and they don't have to handle it themselves as a young person, but they can go find that trusted adult to say, hey, I really feel like this person might need to talk to someone.
Terry, let's go to you. What kind of advice do you have for parents about those tough conversations that they need to be having with their kids about what they're seeing on social media?
Well, they can get support from other parents. If they don't feel comfortable, we have some wonderful school counselors and social workers. We're actually getting mental health professionals in our schools as well. So they can ask for support around what to say. It's just such an important conversation. I love when you mentioned it about that every child deserves that one adult. And one of the good things, you might already know that North Carolina passed Senate Bill 476 in 2020. And in 2021, schools, July, every school system and public school unit, charter included, had to submit a mental health plan to the Department of Public Instruction. And in that included 6 hours of training for all certified staff in mental health awareness, sexual abuse. So our staff members are getting additional training. So if that one person is not a person that lives in their home, it can be a person in the school system. And that is one of our goals with Project Aware, is that we increase school staff's awareness. So like in 25 years ago, if a kid wasn't eating, they'd say, oh, you trying to diet for the prom? Well, now we know with the training, oh, he's not eating, she's not eating, they've lost 15 pounds. Gosh, that's one of the signs of depression. So it's really wonderful that our legislation is catching up with training school staff. So don't be afraid to reach out to school staff. Community providers like Chad's group, we have professionals that can help parents with this.
That's great to know that for us as parents, that people in our schools, everyone, the staff in our schools, that they're equipped for this now. That's great progress for North Carolina. Chad, let's go to you. Social media is often blamed as the reason for low self-esteem and isolation. What kind of advice do you have for parents to try to combat those challenges?
Yeah, so I think you need to try, again, monitor your kids' usage of the internet and their phone. Encourage them to find healthy outlets outside of sort of the swiping up that they do on these apps, and get them, doing things like drawing, listening to music, maybe going for a walk or a hike, getting some physical activity. Our kids have lived in isolation for the last 3 years, and I think the bedroom has become sort of this area where they retreat to, and it's, I think, really important for parents to get their kids out now that it's safer to do so, and start to sort of get more normalized with the way we need to interact with one another.
Chad, that's a great point, and I know you're a big proponent of exercising. You can do it by yourself, you can do it as a family, you can get on a team, go to the gym. You really see a huge benefit, I guess, for anyone, but especially teens, in kind of balancing and leveling their mental health in a positive way.
Absolutely. I think Ann put it well. You have to give them that leeway to use these applications and social media, because that is the world we live in. But there needs to be a balance, and that can be difficult to find, but as parents, we need to do our best to make sure that that's happening.
Yeah, I think just to put a point on what we're talking about here with social media, I think you're all saying we've all got to put the phones down. We as parents have to lead the way, potentially, in putting the phones down, encourage conversation with our kids. Let's get out and do things together as a family. Let's talk, let's exercise, let's put the phones down. And I think that's a good first step. It can be a challenge around the house, but that's a great first step. I want to talk about something else here, something called school refusal. And a new study this week found many more children across the country are refusing to go to school, and they actually have a name for it. It's called school avoidant behavior. USA Today reported on that this week, and a mental health expert reported the crisis has gotten so much worse since the COVID pandemic. I want to go to each of you and understand how parents can navigate this. So there's the definition of it. When a school-age child refuses to attend school or has difficulty being in school for the entire day. And a lot of this traces back to COVID and the isolation of COVID. And I want to talk about COVID isolation as well, because I hear from parents all the time about that their kids were isolated during COVID, and coming out of that can be a challenge. And you work in a school environment every day. What are you seeing about this, and what can parents do about it?
I guess what I would say is that, I'm just thinking about my two sons, and there have been days when they go to school, because I take them to school with me. But when one of my sons, just recently, I got a call from the school nurse, and he was saying that he was, his stomach hurt, and I went and talked with him, and the reality was he was really upset about a grade that he got from a test. And so he's very hard on himself, and he really wants to do well at school. He's putting that pressure on himself. We tell him that grades are not important to us. We just want him to do his best work. But it really bothered him, and so much so that his stomach was hurting. So as his mom, I said, can you go to school? Can you continue learning, or do we need to go home? And when this has happened 6 months ago, the decision was, I really can't learn right now. I need to go home. And I took him home. And then, another time it happened, and it was more about, okay, I can go back to back to class, and I'll be okay. I guess for parents, it's knowing your child. It's also knowing that school does have resources to help support your child when they are at school. There's school counselors. Now we have the ability to get both of our boys support outside of school, where they do talk to someone when they need to, and I'm very grateful that we're in a position to be able to do that. But I really feel like for children and young people, school is where their friends are, their other students are, where they can get their mind off of some problems by learning. They can get exercise in PE or out in recess. So you certainly don't want to say parents force your kids to go to school when they don't want to, but I do feel like it's the encouragement and also coming alongside, getting them the support they need, either that you can provide, or, as I've often felt very helpless as a parent, like I don't have all the answers, I've been able to reach out to other people in the community to help support them and me and my husband.
Yeah, reaching out, that's always a key. Chad, with your two girls at home, what are your thoughts about this? Have you seen this with your girls or their friends?
Yeah, no, so thinking back to the lockdown periods of COVID and the virtual learning, when technology wasn't working and they couldn't get their work done, I absolutely saw my kids struggle with, outbursts and anxiety around that. As what Ann is saying, now we're transitioning back to in-live learning. So the transition to sort of isolated learning was difficult, but now, after a couple of years, that transition back to in-person is just as difficult. So I would agree with Ann. You know your child. If it becomes a pattern, I would say also we have great school counselors, great school social workers, but pediatricians are also a very important part of support to our kids and to our kids' health. And so if you have concerns, I would definitely encourage parents to reach out to their pediatrician.
Terry, what are your thoughts about this? How parents can navigate the idea of school avoidance, their kids not wanting to go to school?
I think it's very natural. It would just be like us as adults if we got to work from home and then we are like, okay, now it's time to go in the office. Well, so some of it is a very natural reaction to actually the demands of going to school. But what this is talking about, I think, is for students that may have had already underlying some social anxiety, and if there are certain issues going on, it's just been exacerbated with COVID. So I really like what Ann said. You don't just say, you're going to school because I said you're going to school. You got to look what's underneath it. What's going on? Is it a big test? Is it a bullying situation? You really have to do some deeper dive to figure out exactly what's going on. And then use the schools as your partner. You can request a meeting with the school counselor or administrator, and you can come up with a plan. Tell them what's going on. I need help with this. Maybe he's greeted by his favorite teacher in the morning, and you have different things to help engage that student. So, and then the final thing, if it is a student with some pretty significant mental health issues, and again, in rural counties, transportation is a huge barrier for students to receive mental health services. So one of the things we piloted is school-based therapy. So you can tell a parent about there is actually school-based therapy. And the majority of providers, they do bill Medicaid insurance, but we also, most of them will have some free slots. So really no one's turned away, and it can be confidential. So that is something that can be of help to parents as well.
Yeah, terrific. We have just a few minutes left. This half hour is really speeding by, but I want this conversation to be not just about these issues we're talking about, but I also want to help families get to solutions and what concrete information each of you can share to help teens and parents navigate mental health challenges and concerns. And let's begin with you. And you mentioned the car drives. Tell us why those work really well for you and your boys.
I have found that for my boys, and I don't know if I haven't talked to too many other parents of boys, but I have found that talking in the car is great. Everybody's facing the same direction. You're able to look outside, look around, and we're listening to music. Sometimes we all sing along, sometimes we don't. But just the car rides to and from school. One of my sons plays soccer, so we feel like we're in the car. I call it the mom bus. I feel like I'm mom busing him everywhere, all over North Carolina. So those long trips are just great opportunities. And a lot of times there's not any conversation, and then just out of the blue, my eldest son will say, "Hey, this happened. Did you know about this?" Or "I saw this in the news on my phone. I want to talk about it because it concerns me." So I find the car is the great place to have those conversations.
And it's not eye to eye. That's what you're saying.
Yeah,
Everyone's looking out the windshield.
Exactly.
And get some car karaoke going, and
right.
it's all good as a jumping off point. I love that.
That's
Great.
right.
Chad, what are your thoughts? You are talking to your teen girls all of the time. What are the concrete ways we can all have better conversations with our kids?
Yeah, and I think it was mentioned earlier. I think having a listening approach is really important. I think as parents, we fall into a trap a lot of times of being wanting to tell our kids what they need to do, and sometimes we just need to really be quiet and actively listen to what is going on and what they're trying to tell us. And that can help direct what we actually tell them as advice on what to do. So I think active listening and talking early and often. As soon as you notice an issue or something is off, have that conversation with your child.
Terry, you've shared some great tips with us this half hour. What else would you like to share to help parents navigate these concerns?
Well, as a therapist, we talk about feelings a lot. So start making it the norm in your household that you're actually talking about how you're feeling. You don't want to stay stuck in it, but you just want to be talking about that. So you're aware and your child knows that it's okay that we're talking about this. Chad, you mentioned the active listening. A parent, if you're working on your computer or doing work or have your phone out, your child knows you're probably not real tuned into them. So you really have to show that you really care. And then if for whatever reason you and your child are in a headbutt about some issue, make sure they can reach out to somebody else. Maybe it's an aunt and uncle. Maybe it's a coach. So just having support, again, that support is huge. Whoever it comes from, kids really need to know that they're being heard. And they also are being heard about what they're not saying, but that body language and all the different signs. So that's probably what I would add.
Terry, we have just a few seconds left. I'd love for you as a former clinician or a clinician to share with us the difference in talking to young boys and young girls. We need to approach those conversations differently, don't we?
We do. And actually, I in my early 20s, I worked for a program called Eckerd Wilderness Camping Program. And I worked at an all-girls camp for 2 years, and then I worked at an all-boys camp for 3 years. So when I worked at an all-girls camp with teenagers, they did want to talk. girls will usually, they want to verbalize more. So they're going to want to talk a little bit more about their feelings. And then the boys were much more action based. They had feelings, but we had to do activities. I was like worn out. They wanted to be chasing this and playing ball this. That's how they could usually talk. They weren't just going to say, I need to talk. But girls are going to be more verbal, and then more probably relational as well. But that's the first thing I think of.
Yeah, terrific. Terry, thank you. And thank you, all of us who are tuning in, watching. Thanks, all of you who have been here for this great conversation. I want to thank UnitedHealthcare as well for sponsoring tonight's discussion. And if you'd like to rewatch or share tonight's conversation, you can watch this town hall again at abc11.com and the ABC 11 North Carolina streaming app. We hope it was helpful, and we're grateful that you joined us. Good night.